Hi, everybody. My name is Howard O, and I'm with the White House Office of Public Engagement. Thank you, everyone, for joining us today on our fourth in our virtual equity series for a month-long programming in celebration and in honor of Asian American, Native Hawaiian, Pacific Islander Heritage Month. That being said, we have an exciting program ahead, and our theme this year is Building Legacy Together, our community's journey of strength and resilience. Today's focus is on health equity. So for centuries, Asian Americans, Native Hawaiians, Pacific Islanders have shaped and strengthened the fabric of our nation. Yet many ANHPI communities continue to face barriers to prosperity and safety, including xenophobic violence, as well as disproportionate health and economic impacts of the COVID-19 pandemic. So this month, we celebrate our community's journey of resilience and pay tribute to generations of Asian Americans, Native Hawaiians, Pacific Islanders who've paved the way for greater opportunity. We also recommit ourselves to confronting discrimination and hate in all forms, so that together we can create an America that is truly equitable and inclusive for all, which is why we are hosting this virtual equity series to provide much information needed and resources directly to communities at hand. So with that, very honored to introduce Crystal Kai, the White House Initiative on Asian Americans, Native Hawaiians, Pacific Islanders, Executive Director, and our close partner on this equity series. Crystal, the floor is yours.
Thank you, Howard, and aloha, everyone. As the Executive Director of the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders, or what we call WHIAANHPI, I'm honored to welcome you today as we are very proud to co-host this event along with Howard and the White House Office of Public Engagement as part of our AA and NHPI Heritage Month virtual equity series, where we have been hosting equity roundtables on different issues throughout the month of May. As we come together today to discuss how to build a more equitable future, I also want to take a moment to honor and reflect on the legacy of the late Secretary Norman Mineta, who passed away earlier this month. Our hearts go out to the Secretary's family and loved ones during this difficult time, and we know that we will continue to benefit from the tremendous legacy that he leaves behind. In honoring the Secretary's legacy, we reflect on the many challenges that our communities have overcome, as well as the work that we know we still have ahead. And we know that in particular, these past 2.5 years have truly been unlike any other, as our Asian American, Native Hawaiian, and Pacific Islander communities have been hard hit by multiple crises due to the COVID-19 pandemic, as well as so many longstanding inequities that have been really exacerbated over the past 2.5 years. On top of this, we have seen a rise in anti-Asian hate, with over 339%, with a 339% increase over the past year alone, that has brought heightened fear and also mental health challenges that our communities have faced. And so we have a very great and esteemed lineup of speakers that we will be hearing from later today to talk about so many of the issues and health inequities and challenges that our communities are facing, but also a lot of the work that the Biden-Harris administration is doing to address so many of these longstanding needs. And in particular, I have the honor of introducing our next speaker, Congressman Ami Bara. Congressman Bara represents California's 7th Congressional District in the U.S. House of Representatives and is a member of the House Foreign Affairs Committee, where he serves as chairman of the Subcommittee on Asia, the Pacific, Central Asia, and Nonproliferation. He is also a longtime member of the Congressional Asian Pacific American Caucus, where he serves as the co-chair of its health equity or healthcare task force. And so with that, I will be we're proud to introduce Congressman Bara.
Hi, I'm Congressman Ami Bara of California's 7th Congressional District, and I want to thank the White House Office of Public Engagement for allowing me this opportunity to talk about some of the issues affecting our broad Asian American, Native Hawaiian, and Pacific Islanders communities during this National Heritage Month. You know, as a physician by training, one of the things that is of most concerning to me in our broad API, Native Hawaiian and Pacific Islander communities is the issue of domestic violence. You know, I see it in my own South Asian community where, you know, studies have suggested up to 40% of South Asian women have experienced some intimate partner domestic violence. We know with the advent of the pandemic, the incidence of intimate partner violence has gone up. The challenge that we face in the broad API community is that often in our community, we haven't created the safe spaces where people can talk about this. People can acknowledge the challenge that's out there. I know that I've been an advocate as we've reauthorized the Violence Against Women Act to make sure we specifically put funds in there that in a culturally sensitive and culturally specific way can create mechanisms, hotlines, and support organizations that are working in the Asian American, Pacific Islander, Native Hawaiian communities to create safe spaces for victims of domestic and intimate partner violence to seek help and find remedies. I also think we all have a responsibility as leaders in these communities to talk to the communities, to raise the level of discourse on domestic violence so that we are having these active conversations and making sure that people are comfortable with this. Another area that I'd like to briefly address is the incidence of mental health in the Asian American, Pacific Islander, and Native Hawaiian communities. Often in our communities, we haven't created that safe space where people can talk about mental stress that they might be under, depression, or other areas. In communities, particularly in first-generation immigrant communities, these are issues that aren't commonly talked about within the family or within the community, but we know they exist. In fact, we see a high incidence of suicide amongst some of the young people in our community. You certainly see the pressures that are placed on some of the young people in the community, but you also see it in some of the isolation that some of the older members of the Asian American, Pacific Islander, and Native Hawaiian communities face. We as community leaders need to come together to elevate this conversation, to create safe spaces where our communities can talk about issues of mental health, but then also work with those organizations that are out there in a culturally specific, culturally sound way, can meet these communities where they are and can provide the services that are readily needed and readily apparent out there. Again, especially as we come out of this pandemic, and especially as we're looking at the incidence of hate crimes against AAPI communities. Lastly, the issue of creating safe spaces for LGBTQ members of the Asian American, Pacific Islander, and Native Hawaiian communities. Often the elders in our communities do not want to talk about these issues or acknowledge the issues. But the truth is that in Asian American, Pacific Islander, and Native Hawaiian communities, we do know that we have LGBTQ individuals, and we've got to create safe spaces for folks to come out of the shadows, to be full members of our community, and to be fully accepted in our community. That's going to take all of us as leaders in the community to say it's okay. We want everyone to be part of our community, and that'll require working with some of our elders to create those safe and acceptable spaces. So thank you to the Biden administration and to the White House Office of Public Engagement for your leadership in this AAPI Heritage Month. Let's go out there, let's make sure we're addressing these issues, and let's be a full participant in the American dream and the culture and fabric of America. Be well, be safe, and let's be kind to one another. Thank you.
Wow. Although he wasn't able to join us live, I'd like to extend a virtual thank you to Congressman Bara, Congressman Dr. Bara. We're honored by the presence and your wisdom of your brilliant heart and mind to combine compassion and service, and expertise is definitely a gift to all of us. Aloha, y'all, and happy Asian American, Native Hawaiian, and Pacific Islander Heritage Month. I'm Erica Moritsugu, Deputy Assistant to the President and Asian American and Native Hawaiian and Pacific Islander Senior Liaison at the White House. Thank you to everyone joining the Zoom to discuss the challenges and progress made regarding advancing health equity for AAN and HPI communities. It's been quite the last 2 years living amidst a global pandemic. It's no secret that the COVID-19 pandemic made even clearer the longstanding health inequities that AAN and HPI communities have faced. Because of systemic inequities in our economy and healthcare system, AAN and HPI communities have been disproportionately burdened by the COVID-19 pandemic. Recent studies have revealed that Asian Americans experience 3.1 times higher excess all-cause mortality, up to 53% higher case fatality rates, and 2.1 times higher the percentage of deaths attributed to the virus in comparison to non-Hispanic whites. Native Hawaiians and Pacific Islanders, in particular, have faced significant COVID-19 health inequities. In early 2020, NHPIs had the highest COVID-19 case rates within specific states and counties compared to all racial and ethnic groups. So the pandemic really spotlighted the longstanding inequities impacting communities of color, including health inequities. Moreover, as a direct result of the spike in anti-Asian hate and violence since the start of the pandemic, the mental health of many individuals and communities has consequently suffered. Asian Americans who experienced racism felt more stressed by anti-Asian hate than the pandemic. 1 in 5 Asian American victims of racism experienced mental and emotional injury caused by encounters with racial bias and ethnic discrimination, racism, and hate crime. Asian Americans who have experienced racism have heightened symptoms of depression, anxiety, stress, and physical symptoms. I'm so proud of the mental health forum that Dr. Biden, our First Lady, Admiral Murthy, our Surgeon General, and Selena Gomez of a lot of fame held yesterday here in the White House. It included the announcement of the Mental Health Youth Action Forum Fellowship that includes 10 of 30 extraordinary young AANHPI leaders committed to the mental health activism and the core principle that mental health is health. This is all the more remarkable, as Dr. Bara, Congressman Bara said, that when you consider how hard it is to manage mental health crises, let alone talk about it openly. These are brave, active in the world for the better, good, and inspiring leaders, and couldn't be more proud and hopeful. For all of these reasons and more, I'm excited for this roundtable today and pleased to introduce our special guests for this panel discussion. If you don't mind turning your cameras on. Dr. Stephen Cha, Counselor to the Secretary at the Department of Health and Human Services, and Dr. Sejal Hathi, White House Senior Policy Advisor for Public Health. Doctors, thank you both for joining us today.
Nice to be here. Thanks.
So I'd like to start with a question addressed to both of you. The COVID-19 pandemic has exacerbated longstanding health inequities that AANHPIs have been facing. What are some of the challenges and trends unfolding across the nation and administration initiatives to advance health equity for AANHPI communities? Do you mind if I start with you, Dr. Hathi?
Sure, thanks so much. And let me just reiterate what Dr. Shah said in that it's an honor to be here, grateful for the community's interest in this issue, and also for the administration's commitment to improving access to health and health equity for all vulnerable populations, the AANHPI chief among them. So, Erica, I think you did an amazing job outlining the range of challenges that face and burden this community, COVID-19 being perhaps the most conspicuous, if proximate of them, but by no means the only one. Let me just emphasize, however, what we are seeing with COVID-19. You know, in spite of misconceptions around the death rate and burden of the pandemic on Asian Americans, the reality is that, as you noted, Asian Americans have higher COVID-19 case fatality rates than any other racial ethnic groups, and the second highest increase excess mortality in 2020, and some of that burden has persisted over the past couple of years. And the reason for this, mounting evidence suggests, is disproportionately low testing rates, greater disease severity at case presentation, various socioeconomic factors, and racial discrimination that contributed to these disparities. So, as I'm sure my colleague at HHS will no doubt further describe, the administration is immensely committed to tackling the wide scope of challenges impacting communities that have been historically overlooked and underserved, the Asian American community among them. And to start, in May 2021, President Biden signed Executive Order 14031, establishing the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders within HHS, returning the initiative to the department where it had first launched in the 1990s. In his first week of office, President Biden also signed Executive Order 13995, establishing the COVID-19 Health Equity Task Force, which he charged with developing a series of recommendations and action plans to mitigate the health inequities caused or exacerbated by COVID-19. Among its final recommendations, this task force last November published this, namely that the federal government should advance cultural responsiveness to language access and increase awareness of the different experiences of Asian Americans, Native Hawaiians, Pacific Islanders, and other populations facing pandemic-fueled xenophobia and discrimination. And it encouraged us to do this by requiring federal agencies to make communication transparent culturally and linguistically inclusive, allocating sufficient funding to federal agencies to review enforcement of anti-discrimination protections, and to implement solutions to address gaps in prosecuting allegations of discrimination, and mobilizing action plans to quickly respond to discrimination and hate crimes. Among its other recommendations, the task force also urged the federal government to work with the agencies, state, local, tribal, and territorial governments to ensure community-centered solutions to target and reach the NHPI communities to access vaccines, and also to strengthen anti-discrimination protections for these communities and support the investigation and prosecution of hate crimes. So, I mean, I actually could go on with the number of recommendations in the task force final report that are relevant to this community, but we have already begun to act on this, and there is a very vigorous effort within the White House and at HHS, the Department of Health and Human Services, to realize and enact the recommendations that are contained in this task force. Dr. Shah, I know there are a number of actions that various operating divisions within HHS have already taken to additionally support this community, but I want to turn it to you to maybe describe some of those for our listeners.
Thanks so much, Sejal. I appreciate it. And great summary of all the work today, and just I think underscores the commitment. And I will just add a note directly from Secretary Becerra, who is my boss here at the Secretary of Health and Human Services. This is a passion of his in terms of thinking about inequity and advancing health equity in general. How do we shift the culture and resources, and how do we institutionalize that within the department? And in particular, HHS is the proud home now of the WHIAANHPI as described above. And we don't plan to let that go, by the way. The President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders. So let me just talk about two things real quick in terms of, Erica, your question about, how are we how we think about the challenges and trends. I think two snapshots. One, what are we doing differently as a department? How are we behaving? And then the second thing, I'll pick up on some of the things Sejal talked about COVID. Those are the two buckets. So how are we thinking differently? In addition to really being the proud home now WHIAANHPI, we've really reinvigorated something we call the Health Disparities Council, which is a department-wide forum for advancing health disparities, and health equity for racial and ethnic minorities and other underserved and marginalized populations. All the divisions across HHS are here and really help to steer the work and the identity and a home for all these issues, to be sure there's a place and a voice for some of these issues coming to the fore. It also goes down to the nature of the kinds of staff that we're trying to recruit all over the country. It's not just to our home here in DC. The Centers for Disease and Control and Prevention funds, for instance, the Pacific Island Health Officers Association, which is training and recruiting the next generation of public health leaders. And then how do we think about, how are we intervening when we're hearing things? So the Office of Civil Rights collaborated with the Partnership Center and other agencies to address concerns from the Sikh American community about their religious rights to maintain facial hair in the context of requirements on mask and respirator wearing. So if it just like you think about all of those pieces, what we're doing as a department differently, how we're asking our agencies to work with communities differently, it's about an identity shift and a culture shift that we're trying to think about. What does that mean for our work? So, just to talk about COVID for a second, which is obviously is identified by both Eric and Sejal, like the most pressing thing that a lot of us are thinking about. The Office of Civil Rights issued guidance on federal legal standards prohibiting race, color, and national origin discrimination in COVID vaccination programs. We heard reports, we took action, we responded. That was December 2021. HRSA also awarded Health Resources Services Administration, we can't talk without acronyms here in the department, awarded more than $82 million in American Rescue Plan funding to organizations serving Asian Americans and Native Hawaiian Pacific Islanders to expand their workforce to hire and mobilize community outreach workers, community health workers, social support specialists. How do we think about getting vaccine out to communities, not just through health professionals, but really thinking about our community partnerships as well? And similarly, those supported the Health Resources Services Administration health centers, with that support, delivered 1.7 million COVID-19 doses to patients of Asian descent and over 200,000 COVID-19 doses to Native Hawaiian and Pacific Islander patients. So that partnership really resulted in millions of doses getting delivered. And the last thing, I'll stop. I'm looking at the clock. We're already burning through time here, but in terms of NIH, who works with us, so I want to end with this one because it's also important to figure out how do we listen, how do we hear, how do we take in messages. So as we're thinking about the vaccine and the take-up, particularly in the WHIAANHPI community, NIH-funded investigators funded focus groups on vaccine hesitancy in Los Angeles, including focus group participants who self-identify as American Indian, African American, Filipino, Latino, or Pacific Islander, and really identifying what are those insights and recommendations to address vaccine hesitancy in multiple ethnic communities. It's not just the overall polling. We're diving deep to really listen and hear in terms of how do we make these efforts better. So I'll just stop there, Erica, but really proud of the work that's happening at the department, and it's just a huge priority for us.
No, it's a point of pride for, I think, of a lot of us to be in this work in this moment, and your all's enthusiasm for running over time, because there's so much going on, there's so much that needs to be done, and you're doing it. I get the enthusiasm, and absolutely love hearing you talk about the work that's underway. If I could just pull a kind of two threads out of the President's State of the Union address. Number one, he acknowledged, the pain that the Asian American, Native Hawaiian, and Pacific Islander communities are suffering, in this spike in anti-Asian hate and violence on the one hand, and also he talked about a national unity agenda and the crisis of mental illness in our nation. This is what he used his biggest speech of the year to talk about, y'all. And it's true. In the past 2.5 years, the nation has seen an unprecedented rise in anti-Asian hate and violence, and it's fueled anxiety and distress, amounting to mental and behavioral health crises for our communities. So Sejal, I was wondering if you could share what's being done to effectively address mental health issues for the AAN and HPI communities in this moment.
Thank you, Erica, so much for that question. I do want to table set for a moment and note that even prior to the pandemic, significant research and data indicated that more than a third of Asian American adults reported that they struggled with poor mental health, even as they are less than 3 times as likely as white Americans to seek and to use mental health services. So this is a long-standing challenge that COVID has compounded, and exposed, but certainly not precipitated. And several factors contribute to this disparity in care. First, there is a persistent and harmful misconception that the needs of the AAN and HPI communities, an incredibly diverse group, are monolithic. Even as we have touched on, the community represents over 30 distinct ethnic groups in more than 20 countries that occupy a range of socioeconomic backgrounds. And this narrative persists in large part due to the lack of disaggregated data. And then second, despite tremendous gains in coverage enabled by the Affordable Care Act, high costs continue to prevent many Asian Americans and NHPI community members from accessing the care that they need. And finally, we know that discrimination, language barriers, insufficient diversity and cultural competency within the mental health workforce further exacerbate this issue. So the president recognizes these needs, and in his national mental health strategy launched at the State of the Union enumerated numerous initiatives to improve access, quality, cultural competency of mental health care for all Americans, and particularly the AA and NHPI populations. So first, well, what does that mean? First, we proposed a dramatic increase in funding for existing and new programs that expand the pipeline of behavioral health providers, investing special attention in building a behavioral health workforce that looks like and is better able to connect with the patients they serve. The president's FY23 budget, for instance, proposes $22 million for the Minority Fellowship Program, which since 1974 has been working to increase the diversity, the knowledge, the skill base of behavioral health practitioners trained to deliver culturally competent care. We're also working to meet communities where they are and to support their own ideas for promoting resilience and well-being. This is why the president's FY23 budget proposes a first ever program housed at HHS, the Health Resources and Services Administration, to invest in locally driven initiatives that integrate mental health services into anchors of community life, like libraries, post offices, local community centers. And it's especially important to us that these services feel safe, accessible, familiar, and that most likely means that they're operating operated by people that local communities know and trust. And finally, we recognize the imperative of centralized data, best practices, and guidance on effectively serving the AA and NHPI communities. And that's why, and apologies for the background noise, I'm working from home today. But that's why this week, through the Substance Abuse and Mental Health Services Administration, HHS announced a nearly $3.5 million 5-year grant opportunity to develop a center of excellence, advancing behavioral health care for Asian American, Native and Hawaiian, and Pacific Islander communities while reducing behavioral health-related disparities. This center of excellence will promote culturally and linguistically appropriate behavioral health information and practices. It aims to provide training, technical assistance, and consultation to practitioners, educators, and community organizations on addressing the mental health impacts caused by unconscious bias and hate against AA and NHPI communities. So this is just really the beginning of what we are doing. The president launched a 3-pronged strategy to transform mental health services and supports for all Americans. And at any point, we are eager for and welcome the ideas and suggestions from members of the public, those on this call, about what we can be doing to even better serve the community.
Amazing, Sejal. Thank you. Steve, I was going to ask you a question about language access and the department's work on it, but Sejal's talked about cultural competency in this regard and the need for language access. And so I'm going to ask another fan favorite question about data disaggregation. The diverse communities are often overlooked or misrepresented in mainstream narratives and policies concerning health disparities because data collection practices have aggregated the population into a subgroup of, quote, API, which effectively masks disparities amongst the underserved populations. This is threaded throughout, I think, our discussion so far, but I'm wondering if you could share what's being done to ensure that timely and disaggregated data is collected and accessible to policymakers and to community leaders. Take it away. Thank you.
Yeah, and just to say back to you, look, you can't fix what you can't see, right? And so we know that. And let me also be very clear in saying, look, it's true that for a lot of the reasons that you talked about, for a lot of programs, we don't have that nuanced understanding. We need better disaggregated data. We need to understand the differential experiences and outcomes in health and human services systems, not just within HHS, but within our partners that we fund as well. How do we think about all the reaches of all our programs across all the department and all our partners across the nation? So I think we're taking action steps to think about and enhance the availability, quality, and collection and use of those disaggregated statistics. And so one example, again, let me start with the programmatic in terms of how we're thinking about this. We have an HHS Data Council and there's an equity subcommittee. So they're taking a survey of all our HHS service programs to say, hey, look, how is your data available and how is it used and how is it disaggregated? We're going to take that survey data to understand and develop departmental-wide recommendations, to understand challenges about not just, again, our own programs, but our partnered funded programs, to think about how we're improving that disaggregation and data collection. Just as a couple snapshots of areas where we're looking at the maternal and child health jurisdictional survey, which is a really important tool to understand maternal and child health. How can we think about better disaggregation of data by AA and NHPI subgroups? Already later this fall, we're already in the works. CDC's National Center for Health Statistics has a really important survey called the National Health Interview Survey. This formates so much of what we understand about American healthcare comes from this data source. We've already had a little bit in 2016 in terms of trying to get better subpooling between AA and NHPI. We're going to build on that and expand on that for the release that's later this fall to think about NHPI and select Asian American subpopulations, including Chinese, Filipino, Asian, Indian, Korean, Japanese, and Vietnamese. And how do we expand the number of outcomes that we're looking at with that data as well? So as we get better at this, we can build on that strength and keep going. And then, of course, all of our NIH programs, whether it's RADx, which is Rapid Acceleration of Diagnostics for Underserved Populations, or NIH's All of Us research program, which is our partnership with communities. How are we collecting and disaggregating data for all of our AA and NHPI populations? So much more to say there, but just 3 quick snapshots in terms of we're trying to think about this in all of our programs with both our own programs and our funded programs. And we really anticipate these actions are going to better equip HHS, to your point, to then take this information and take better action and understand where that data and evidence is to develop not just where our areas of need are, but to develop culturally and linguistically appropriate interventions that meet the needs.
I love ending on a high note about what hope and optimism in our future looks like based on our present endeavors. So Dr. Shah, Dr. Happy, thank you so much for this robust and rapid fire, richly informed dialogue this afternoon. I really appreciate your time and your wisdom. With that, I'm going to pass back to Executive Director Crystal Ka'ai for our next panel that's populated with some of my own fan favorites, some community leaders who've inspired me and keep me in this work. So thank you. Over to you, Crystal.
Thank you so much, Erica, and thank you to Dr. Cha and Dr. Hathi for providing those updates and important perspectives on the critical work the Biden-Harris administration is doing to improve health equity for our AA and NHPI communities. Next, we have a distinguished panel of community leaders who will be sharing some of the work that they are doing to promote health equity for our communities. We have Juliet Choi, who is the President and Chief Executive Officer of the Asian and Pacific Islander American Health Forum, Jeffrey Caballero, the Executive Director of the Association of Asian Pacific Community Health Organizations, or APCHO, Dr. Nelly Tran, who is the immediate past president of the Asian American Psychological Association, as well as an associate professor in the Department of Counseling and School of Psychology at San Diego State University. And last but not least, we have Dr. Sherry Daniels, who is the Executive Director of Papa Olulokahi, where she leads efforts to improve the health and well-being of Native Hawaiians. So a warm welcome to all of you today. Thank you so much for joining us. All of your organizations and the work that you do work closely with our AA and NHPI communities to address health inequities, and many of which we know have been exacerbated throughout the course of the pandemic. This is a question for all of our panelists, but could you speak to the major health needs facing AA and NHPI communities, both related to COVID-19, as well as any broader systemic health challenges that our communities are facing? And why don't we go ahead and get started first with Juliet. Juliet, you are on mute.
It's a wonderful privilege to be here with you, Crystal, and all of our community friends and partners and colleagues. I think the institutionalized barriers that we all face, I think a lot of our experts have already highlighted. The challenge of disaggregated data, language access continues and remains. I do want to put a special note and exclamation point on community resources, both the community relationships and where the federal government is with regard to community relationships. And also, I think where the community has done so much, we have on our own, I think, done tremendous amounts of work to tackle, bring voice to institutionalized barriers, but bring it forth through strategic partnerships to tackle some of these barriers. And before we end today's conversation, while we talk about disaggregated data language and language, and we certainly look to our enforcement partners like Health and Human Services Office for Civil Rights to do additional enforcement around language access, which really is an extension of Title VI national origin discrimination. I do want to highlight just a couple of areas. I would love and invite an ongoing conversation of, are the new federal and broader resources on par to tackle the issues and the impact of barriers our communities are facing? If I can opine for a moment, I would suggest that while the Biden administration, the Biden-Harris administration leadership has been incredible, and a wonderful example is that we have more millions of dollars today than we have over the last many years when it comes to community navigator funding. However, my overarching question is, do we, and I think we do need additional resources at the federal level to state that we invest in the AANHPI communities to tackle these institutionalized barriers. Last but not least, what I also wanted to highlight is that telemedicine has been an incredible game changer in COVID. I think pre-COVID, but so much more for COVID. And as a public health and social justice advocate, I just want to underscore, when we think about social determinants of health, when we think about the opportunities to invest in our public health infrastructure and create solutions and innovation for game-changing strategies, I do think telemedicine, particularly for the AANHPI communities, when it comes to bridging the barrier of language and culture, we need greater investments and greater innovative strategies when it comes to telemedicine. And Crystal, again, thank you for your leadership. And I'm so glad to be here and look forward to hearing from our dear friends, Jeff and Sherry.
Juliet. And Jeff, same question to you. So Juliet talked about just a lot of the work, and this is, we all know this is true. Just oftentimes our communities have really had to step up to provide services directly to our communities, whether it's providing in-language services, culturally competent services. And so what are some of the challenges that you are seeing, either longstanding inequities or specific challenges that have been highlighted throughout the pandemic?
Well, first, I wanted to just thank you, Crystal, for the opportunity and the invitation to participate in this dialogue. I also wanted to thank the Office of White House OPE for that invitation as well. Listen, so much have already been said, and there's going to be even more information that's going to be shared over this discussion. So I want to try to keep it as simple as possible. I think everybody knows that there are unique health disparities that is particularly prevalent among Asian Americans, Native Hawaiians, and Pacific Islander communities, like diabetes and heart disease, tuberculosis, and hepatitis B. I'm not going to go into that because we don't have the time, but the real, I want to focus on two particular areas. One, I just want to emphasize again, because I think this is a problem that we've been working on for over 30 years. And it is still a problem in this country, and that's the collection of disaggregated data. The tendency to paint with a broad brush continues to ignore the diversity and the vibrancy of our communities, the ethnicities, and the languages that are spoken. This is especially appalling for smaller populations such as the Native Hawaiians, the Pacific Islander groups, as well as the South and Southeast Asian communities. COVID made that very real for us, not just nationally, but throughout, through all the different states across the country. Another critical issue area, a structural barrier for Asian American and Pacific Islander communities is our inability to access and obtain health care for our most vulnerable during the first 5 years, because we're barred from being able to access Medicaid services for our vulnerable population. This is something that just needs to, our country needs to find a way to overcome. I'm going to stop here and just talk more about the solutions later, but I'll leave more time for my other colleagues.
And you touched upon, a great issue. I mean, we have a large immigrant population, so, there are definitely barriers to accessing healthcare there. We also talked about some of our indigenous communities and also other vulnerable populations, including our Native Hawaiian and Pacific Islander communities. So Sherry, I want to turn it over to you. You have done so much work in Papa'olelo Kahita, so much work with our Native Hawaiian communities, but you also, more broadly do work with the Pacific Islander population as well. And so can you speak to some of the challenges that you have seen in those populations that may be a little bit more unique than what we're seeing in some of our Asian American communities?
And I think Jeff and Juliet, thank you. They covered a lot. And in the sense of time, I do want to touch upon social determinants of health impacts. I think, we recognize that our communities culturally view and have beliefs that maybe are not part of the norm when we look at some of our social determinant of health factors. So I think that's important to recognize that that plays a role. Systemic issues, I think Juliet touched upon it briefly, but systemic issues and generational and cultural trauma are unique factors that impact our NHPI communities as well as our Asian American. But I think I really want to touch upon that, and I want to say this, that communities always have and will always continue to do what they need to do to survive. We've seen that pre-COVID, we saw that evidently through COVID, that no matter what, they will find the resources and have the resiliency to survive. And I think what happens is some of our partners don't quite recognize that, and they don't see that they've had to do more to just have minimum. And so therefore we're going to need the resources to help communities and all of our communities uplift that and not have them, piecemeal things together to survive. And I think part of that also ties into the concept of trust. Our communities have a lot of issues around trust, and how we develop trust and how we earn trust in our communities are very unique in itself. And so one of the things, as great as telehealth has been for COVID and to have access availability, that lack of in-person creates this whole other level of barriers for our communities when we're not accustomed to having things separate us. Culturally, for Native Hawaiians especially, and Pacific Islanders, the connection factor is huge. So how do we address trust, which is not a data-driven piece? It's a very interpersonal, and to have trust lead is often not as commonly seen. So I think those are some of the barriers that our communities are facing. Thank you, and thank you again for inviting us to the table.
Sherry, and those are really great, just examples you brought up, just the fact that absolutely our communities, regardless of whether they have the funding or the resources or not, have always found ways to survive. And I think, as a result, there's this misconception that our Asian American, Native Hawaiian, Pacific Islander communities don't need resources, when in fact we know that is not true. To that point, I know this was touched upon a little bit earlier in the conversation in our previous panel, but Dr. Tran, if you could talk a little bit more about specifically the mental health needs of our communities. We know that unfortunately, it's not just the pandemic, but also this rise in anti-Asian hate and violence we have seen has really traumatized our community in such a horrific way. And we continue to see acts of hate and violence continue to happen. I mean, even as recent as this weekend. And so could you speak to just some of the work that you're doing, as well as the resources that are needed to address the mental health needs of our communities?
First, thank you so much for having me. This is a distinct honor to be here to represent and to share what we've been doing. I think, first and foremost, I'm really excited that mental health is included in this conversation. It's often forgotten, I think, when we think about physical health and not thinking about mental health. But in this kind of unique time, the pandemic coincided with the rise in anti-Asian hate and integrated with it in really significant ways. We were lucky enough to partner with lots of our sibling psychological associations and local cultural-based organizations across the country to conduct some research and a needs assessment during COVID. And we found some really striking findings, and that anxiety and depression has risen. It has always been high within our community, but when we're able to disaggregate the data, as we were in our study, we found that younger adults, ages 18 to 24, those who are making less than $25,000 a year, US-born Asian Americans, women, non-binary adults, Southeast Asians, and multi-ethnic Asian Americans were all groups that we saw report higher symptoms of anxiety and depression. And I think it's the going hand in hand, right? The physical health and the mental health, that folks in our community sometimes can talk about one, but not the other, but that they are related. So sometimes talking about physical health might be simpler or easier for some of our community members rather than mental health aspects, but that practitioners have been trained to ask about both would really help our community to be able to target and address the needs that they might have. I think it's also really important, this idea of disaggregating our data is so important, because as you are able to disaggregate the data, you can really see what's going on. So, for example, what we found in some of our studies is that race-based traumatic stress, especially that related to the anti-Asian hate that we've seen over the last 2 years, is producing an elevated response of stress symptoms. But we also see during this exact same period that within our Native Hawaiian and Pacific Islander communities, there was a greater report of financial stress that was burdening the community, and that we can't think about just one type of stress impacting the community without thinking about each of our distinct communities. And I think, as a researcher and educator, what I think is really important and what I would really like to see happen is an emphasis on training those who come from the community to be able to do culturally specific healing practices, that we move away from merely looking at evidence-based practices and look at what some of us are calling practice-based evidence, that our communities actually do know how to help communities, our own community members, to heal and to overcome oppressive forces within their local environments, but that sometimes federal funding doesn't support that work because it hasn't been traditionally written up as evidence, and that we need to support that work as well. And we need to partner with more folks who are on the ground doing the service delivery and making sure that more folks from our community have access to the education and training to allow them to be providers within our disciplines.
For that,
So I would say that those.
Okay, go ahead. Sorry.
I would just say that those are some of our biggest challenges right now from our end, but that we also found that there was great hesitancy to access care. And we've always known this to be the case, that there is a stigma against seeking mental health services. But one of the questions that I would love for all of our providers and educators to constantly ask is whether the stigma is merely coming from our cultural groups, or rather whether the stigma is a warranted part of our educational system, that perhaps our providers that our community members have access to don't have the cultural competency, are not culturally congruent enough in order to provide the kind of care that our community members require. So I'll just stop there and
yeah, thank you.
allow my
No, thank
colleagues
you
to
so
speak.
much,
Thank
Dr.
you.
Tran, for sharing all of just the wealth of information and work that you've been doing, but also really also best practices that we can consider moving forward. So I know we are limited on time, but again, all of you really have highlighted the importance of community-centered approaches, which I know this is a big priority for our White House initiative on Asian Americans, Native Hawaiians, and Pacific Islanders. And we heard from Dr. Cha and Dr. Hathi about a lot of the work, a lot of the investments that are being made directly into communities as well as community health centers. And I know that many of your organizations have also, directly benefited from a lot of these investments. And so just moving forward, I think what would love to hear about a little bit more about what are some of the opportunities that you see that can be leveraged really to advance health equity for our communities. We did hear from Dr. Cha and Dr. Hathi, as well as Erica, about some of the investments that are being made directly to prioritize data disaggregation, language access, culturally competent care. But what more can we be doing through the federal government, and how can we better engage moving forward on this really critical issue, so that we can build back better, not to the status quo, but build back a better future, a brighter future for all of our communities. So I'll start with you, Juliet. I know the Health Forum has been doing really tremendous work in this space.
Thanks so much, Crystal. And I always learn from our fellow colleagues and friends in these discussions. I think a message I want to share is, whether it's the WHIAANHPI communities or communities of color, LGBTQ, disability, we've been in such a survival mode. And we know at our core, part of our DNA is that we always have that thriving mode. So briefly, I want to ask us to hold on to that. In terms of where we are and looking forward, I will say, for those of us in the healthcare space, we know that navigator support from the federal government has been absolutely critical, because that's a program that is closest to uplifting our community leaders to reach out to community families. And for the audience that's joining us, During the Obama administration, we had about $60 million plus of an investment. The last administration, that investment fell below $10 million. And thanks to the Biden-Harris administration, that investment is now $80 million plus. But talking with our community networks, we just know with that, it sounds like a large amount of dollars, but it's really not if you think about 50 states and territories. And so I would applaud this current administration and ask for further investments, not just from government, but also private partnership and private industry, because that is really what gets to leveraging community leaders to reach out to our communities for greater health and better survival. Lastly, I think my last 2 points that I wanted to highlight is that we've been talking about the COVID pandemic, and I'm going to get it just a little bit wonky for about 12 and a half seconds here. Because of the COVID virus and how it's recognized as a national global public health emergency, it's created opportunities for all of our communities to further enroll people and get them access to health insurance, including Medicaid, that they otherwise did not have access to. And that includes about 15, 16, 17 million Americans who never had access to care, who now do have access to care because of this administration's priorities. However, in the next months, maybe the next year, we are potentially facing a cliff where our primarily poor and immigrant communities, the 13 to 15 millions who now have Medicaid access that never did before, we may be in a situation where they all lose their coverage. And if that happens in the next 6 to 12 months, that also means our immigrant and communities of color are going to be on the negative receiving end of that. And so that's why conversations like this are so important in terms of what are the solutions going to be going forward. Last but not least, what I want to underscore, the gains that I feel like, and I share this on a personal, professional level, the gains from a healthcare equity standpoint, a racial equity standpoint, I feel like we have made with COVID, with anti-Asian violence, with racial reckoning, since George Floyd's murder, we have achieved greater progress in a shorter amount of time because together amongst us, but also with all of our community partners, we've stood in allyship. And I think before we conclude today's conversation, I think it's important to recognize our Black, Latino, disability, and LGBTQ communities, because as much progress as we have made, or perhaps the health forum has made, it has not, we couldn't have done this alone. It's with all of you, but also our communities of color and allyship.
Juliet, and that's such a strong and important point to raise. So thank you for mentioning just the importance of that coalition building and that broader work we do in community with, with others, and knowing that collectively we can work together to uplift all Americans, which has been a big priority for the Biden-Harris administration, embedding equity throughout the entirety of the federal government and the work that we do. Jeff, I know that, APCHO, you all have been doing so much, not just throughout the pandemic, but you had also touched upon some of the other longstanding health inequities and disparities that impact our communities. And so for you, I just, wanted to see any closing remarks or thoughts for us on how we can better leverage existing resources, but also work together to advance health equity for our communities. Jeff, you have to unmute.
Yeah, thank you, Crystal. I realize that I really didn't provide context for many in our audience that might not be familiar with APCHO or with the Community Health Center program. So briefly, APCHO is an association of those community health centers that are focused on providing healthcare home to our most medically underserved Asian Americans, Native Hawaiians, and Pacific Islanders. Yeah, the community health center system or the federally qualified health system is a critical component of our nation's healthcare, particularly for the underserved. Nationally, there are more than 30 million people being served in the health in our FQHC program for the most vulnerable, including more than 2 million Asian Americans, Native Hawaiians, and Pacific Islanders. As Juliet noted, given what we know of how much work these community health centers and CBOs have already done, as Juliet noted, more support is really critical. These organizations are at the front line every day with our communities, and they're already doing so much. 20% of all community health center patients and almost 50% of all of APCHO's member patients are best served in a language other than English. These organizations are critical medical lifelines, communicating accurate scientific information and providing holistic, high quality and coordinated services that are in a culturally and linguistically appropriate way. And as also, so as Juliet and Shari noted, telehealth has made a difference, but in itself, it is not enough. And it really is because data and availability of disaggregated data continues to be a problem. There are still too many instances that entire populations are invisible. The tendency to only address the biggest populations are what we are getting good at, but we got to get better, particularly for our smaller populations. We appreciate that HHS and CMS and other federal agencies, particularly our friends over at HRSA, are specifically calling out the need for data disaggregation. While all of that is encouraging, details to how and how widely this will be implemented and applied is still vital. We still don't know enough. And in particular, aside from the services, dedicated funding for research to collect disaggregated data is particularly important to continue investigating and examining, the vulnerabilities in our community and what being left invisible means to our country. And let me just end by sharing that, aside from data, and like I said in the beginning, the data and language access has been a constant issue in our community for the last 30 years. Government needs to invest more in its internal access, internal language access capacity to ensure that these programs and services are accessible to all in our community. That means incorporating funding for the language access plans that have been developed as part of the, including all of the government grants and resources and announcements. This year, CDC Division of TB Elimination and Hepatitis B launched the first ever community education campaign in multiple Asian languages. It's a good beginning, but it shouldn't be the only ones, and it shouldn't be the end. We have a lot more to do to help make sure that these areas are addressed in our most vulnerable communities. Thank you again for the invitation.
Thank you, Jeff. And you're absolutely right. We know that so many of these issues that have been raised today by all of you are not new issues. They have been longstanding inequities that our communities have been facing for decades. And thank you again for just bringing those issues to light. I know we are limited on time, but I do want to make sure we get to Sherry as well as to Nelly and just finish up this, wrap up our panel. For both of you, again, same question, what are some of any closing or parting thoughts you have for us, as well as ways that we can just continue this dialogue and continue to work together? We know that there have been tremendous strides made under the Biden-Harris administration, but there is still a lot of work to do. So Sherry, I'll turn it over to you.
I'm going to kind of leave everyone with this olelo no ea, or this proverb, I guess. It's called "A'ohe pau ka ike e ka halau ho'okahi." Not all knowledge is learned in one school. And you can interpret it however you need to or want to. But it's basically saying that no matter what we say, there's so many schools of knowledge around how we can uplift our communities. We spend a lot of time up in the clouds, right? In the lunnies, in the heavens, kind of figuring out and thinking what we believe is important for our communities. And I think we need to recognize that there are groups that actually are doing the work in the community, and we also need to talk to them. We also need to, right, understand that as Native Hawaiians, we might be one source of knowledge and information, but they are other Native Hawaiian organizations and CBOs. Same thing with Pacific Islands. Our Pacific Islanders in the territories have very different needs than Pacific Islanders in Hawaii or on the continent. And that's the same for Native Hawaiians. There is no cookie cutter kind of concept. So I think, yes, there are broad ways that we can continue to uplift and have opportunities, but we also have to kind of step off of that and dig deeper, because some of these issues that are going to help us create sustainable long-term shifts and changes in the paradigm that we think is gonna, it's not going to be that research-based, cut and dry, this is how it is. Some of it is going to be a little bit more interpersonal. And that's how our communities are. And so I think we have to recognize that there's going to be a multi-pronged approach for all the different issues we have, from data to policy making to funding to agencies understanding and figuring out how they can move forward and behave and interact with our communities. And that's the same for communities. I think we all have to continue to play a role in what that looks like. So thank you again, Crystal.
Thanks, Terry, for sharing your mana'o with us. Next, but last but not least, we have Dr. Nelly Tran. So again, any closing thoughts or parting words for us on how we can continue this engagement and work together to promote health equity for our communities?
My colleagues here have spoken very well of what is needed in our communities. So I will just amplify what they've said about data aggregation and add this last piece that it is not enough to disaggregate the data and say that there are insufficient numbers within respective communities. We need targeted data sampling. We need targeted data collection and tracking, and we need it to be in language. And so to do that, then we need to have researchers, data collectors, professionals, and providers who can speak the language and who can serve our community at our most local and small levels. And that takes us back to training and education. We need folks to have opportunities to seek the education, to get the training, and to do so in culturally congruent way and in language. And so too many of our young people want to serve our communities, but lose their language and culture in the very training that they are attempting to bring back to our communities. And that will not solve the problem. So we do need to go back and see this as a holistic issue, that to solve our health inequities, we must actually start back with education and our economic inequity, which I am so privileged and honored to be a part of this panel. And I thank you so much for having me here.
Thank you so much. And thank you to all of our panelists for joining us today. We know this conversation could have easily gone on for another hour, but we're just so grateful to all of you for sharing your expertise and knowledge with us on the work that you are doing, but also the work that lies ahead. So, data was mentioned numerous times throughout the course of this session. And so just want to do a plug. Next week, we are actually hosting a data equity summit along with API Data, the National Council of Asian Pacific Americans, as well as the CDC Foundation, because this is a very big priority for our initiative and the work of this administration. So thank you all for the work you did to highlight why data is so critical, and being able to disaggregate that data is important for our communities. Tomorrow, we are also hosting an event to mark the 1-year anniversary of the signing of the COVID-19 Hate Crimes Act, which the president signed into law last year. We know that unfortunately, we are continuing to see so many horrific acts of hate targeting Asian American and Pacific Islander communities across the country. And so we hope that you can join us for that event tomorrow at 11 a.m., which will be live streamed virtually. As I mentioned, we will be having a data equity summit next week on Tuesday. as well as a closing ceremony for AAA and NHPI Heritage Month on May 26th. That will be both in person and live stream virtually. So as we continue to wrap up the rest of our month, our Heritage Month, we hope that we will continue to see many of you engage with the activities that we have planned ahead. Mahalo again for joining us, and happy Asian American, Native Hawaiian, and Pacific Islander Heritage Month.
Thank you so much. Thank you.